There's been a trend nationally in not funding HIV prevention for the last several years. And because New York City spends almost none of its money on prevention, whenever the federal budget cuts prevention funding, New York cuts prevention services. We're here to protest that. But more than that, we're here to say that treatment as prevention is just not enough. We're for treating people who are HIV positive, but we don't think the burden should be on them to keep HIV negative people negative. And we want the city to start spending some money on HIV prevention, because if we rely on treatment to stop HIV transmission, that's not going to happen for a decade or more, and we're going to have hundreds and hundreds of thousands of HIV infections. ACT UP is saying we don't accept any more HIV infections. We want prevention funding, and we want it now.
HIV, spell it out, PrEP.
How do we fight?
HIV,
spell it out,
PrEP.
The DOH claims that only 14% of gay men with HIV are unaware of their status. That's a lie. We know the number is quite higher, close to 40%. Also, the HIV testing the city funds, only 5% of it is actually targeted at gay men. We need the DOH to fight the epidemic where it is spreading among men who have sex with men and transgender women. They're not doing their job.
Frankly, the ability to have sexual relations with other men without infecting them was the single biggest incentive for myself to adhere to my treatment. And it is an undersold thing that many of our health officials are paralyzed to talk about because they're afraid of encouraging condom-free sex. But the point is that condoms have proven themselves to be one tool among many. We need all the tools to prevent HIV, and that includes pushing HIV-positive people to control their own infectiousness with medication.
What do we do? Act up, fight back!
There's a severe lack of education going out to the public at large. There are not just men who have sex with men, not just intravenous drug users. There are people in the city who were born with the virus who need access to PEP, which is post-exposure prophylaxis, and pre-exposure prophylaxis. These people need these drugs immediately before or following exposure to HIV through intimate contact, and the city is not providing it. They're obfuscating numbers, and they're just generally roadblocking the process.
We want data, we want numbers.
All you do is give us data, give us numbers.
All you do is give us rubbers. That brain!
Give us numbers.
All you do is give us rubbers.
I've been fighting the AIDS crisis for going on 25 some odd years, and we're still where it's unbelievable that we've made so little progress. The New York City Department of Health should be ashamed to even call themselves the Department of Health when they're not the Department of Health for all of New Yorkers. And as always, it's been since the beginning of this crisis that men who have sex with men they're the disposable people. It doesn't matter what happens to them, so we don't have to do prevention strategies for them. We know how we can end this crisis. We have a lot of tools, and it's high time that the Department of Health steps up to the plate and starts taking their responsibility seriously and starts saving all of New Yorkers.
Healthcare is a right. Healthcare is a right.
Run more prevent right.
Fight. Healthcare is the right. Fight. HIV, spell it out. PrEP.
How do you fight HIV?
Since 2002, HIV rates of infections have been rising among young black men and Latino men. The New York City Department of Health and Mental Hygiene likes to deal with HIV as a manageable virus. and the record of the management of the epidemic in New York City has been abysmal and continues to be abysmal.
Do your job! Do your job! Do your job! Do your job! Do your job!
Do your job! Do your job! Do your job! Do your job! Do your job! Do your job! Do your job! Do your job! Do your job!
Act up! Fight back! Fight AIDS! Act up!